Hi, this is Dr. Vidyashankar, consultant nephrologist at SSAMI Hospital, Bangalore. So I'll be highlighting on the nephrological problem or kidney problem related to our senior citizens, elderly population, who actually are maybe suffering from these conditions, but since the symptoms may not be the same as the adults are, so they may get ignored. So most common problem what we find in elderly population is they will have issues with the sodium in the blood going down. So that is something called as salt losing nephropathy. Most of the time we ignore it, and they have very subtle symptoms like imbalance, and they will have fall. So they have found in one study that most common cause of fall in elderly is because of the low sodium, which gets ignored, and then we attribute it to the loss of balance. So we have to recognize this low sodium very well, and low sodium can present with very mild symptom like a little bit of dizziness, some memory disturbance or imbalance. So that's the reason any like elderly population, especially more than 75 years, so we should look at the blood sodium levels often checked, because the kidneys, they handle sodium. If they are not able to conserve sodium, the sodium will be lost in the urine, and the blood sodium goes down. A normal blood sodium should be more than 135. When it goes to less than 125, they become symptomatic. Any elderly population, even if they are healthy in the mobility, they are moving around, still you have to check the sodium levels. So it's very important. And the second important condition is urinary tract infections, which can happen in elderly, because they will be having some urinary incontinence, especially in a female patients where they will have mild dementia. Suppose if they have some bladder incontinence, they will be using diapers. So the urinary infection is very important condition, which can make them very morbid and they get hospitalized. So suggestion is not to use diapers because the chance of infection rates are very high. Then the blood pressure. Blood pressure is a very brittle in elderly population, and they tolerate little blood pressure little higher side, but if they bring down the blood pressure to normalcy, then they will have a giddiness and fall. So there are a lot of guidelines are modifying what should be the blood pressure target in elderly. So it's better to keep little higher blood pressure, maybe in the range of 140 or 140 or 145, not to bring it down rapidly, because that can have a lot of symptoms and they can have fall and other serious issues. Then coming to the other conditions which they are already having, like for example diabetes or blood pressure, so we need to have good control. And regarding kidney screening, it's very important that we should screen the kidney diseases in elderly population, because aging process also will be happening in kidney. So sometimes you will get the symptoms may not be there, so we should do a screening for the elderly. So we suggest that elderly population, even if they are not mobilized, the caretakers can do the blood test and then maybe in touch with us, and because they can do a blood routine test like kidney function test, electrolytes and urine routine test, and without a patient also they can come and consult, and maybe we can do a video consultation if they are not able to come to the hospital. So SSAMI Hospital is well equipped with all this kind of audiovisual facility. They can take advantage of this facility and take consultation.